Hi, it's Kati again. Thank you for checking back. Now, the topic that I'd like to talk a little bit about today isn't a tip like some of my other videos. This is just pure information. So you may have to rewind, you might want to take notes, things like that. So the topic is people in the field of eating disorders and who you may need to enlist for help during this time. So the first person that you want to see, and you probably already have seen, is your primary care doctor. So that's your doctor that you see for everything. I have a fever, I may have strep throat, any kind of thing like that is your primary care doctor. Now, I would urge you, as with all the people I'm going to talk about, you need to tell them the truth. A lot of times, primary care doctors will measure and weigh you, and you will see everything. You need to let them know that you're working to better yourself and that you don't need to see those things. They will gladly turn you around while I do them so that you're not aware. I know this may be hard, but it's really important. So, primary care physician is obviously probably the first line that you would see. Now, another person that we want to enlist in our helping army is your dentist. Now, I know that sounds kind of weird. Why does my dentist need to know anything about this? But a lot of times, if we've been purging for many years, it can do a lot of damage to the enamel on our teeth. And we need to let that dentist know what's happening and what to look for. Because there are treatments that they can give you to strengthen your teeth. And we want to make sure that we take the best care of our teeth as we do the rest of our body. Because as we know, it's pivotal to our health that we also have good oral hygiene. That's why they say floss every day and things like that. It's not just so you don't get cavities. It also helps you not get sick as often. So make sure that you see your dentist and you're honest with them as well. Now, the next line of treatment would be someone that you would see for medication if you ever felt the need for medication, and that would be a psychiatrist. Now, a psychiatrist is someone that would usually, they may see you for therapy for a full hour, or they may see you just for maybe 15 or 20 minutes just to go over medications. So let's say you've been down in the dumps for a long time and a psychiatrist placed you on an antidepressant. You would go in each month to talk to them to make sure the dosing is right, that the side effects aren't too much for you or uncomfortable. And you want to be clear with that psychiatrist what's happening. Because medications, as we all know, can affect us differently based on what we're eating, what we're doing, how much water we're drinking. Things like that are important. So again, you need to be honest to the healthcare professionals because they're there to help you. And we need to give them all the information so that they can make the best educated guess as to what's best for you based on their knowledge. So the next line would be someone like me, an MFT or an LCSW. Now, a lot of LCSWs and MFTs, we do the same thing. We're what most people call therapists. Now, that will be the person you go to for an hour. You talk about how you feel and what's going on. They usually offer some guidance, some helpful hints like I've been giving you about, journaling and things like that. They'll kind of be probably your closest person in your army to help you get better. So that's kind of your buddy in crime. You need to tell that person as much as you feel comfortable. They need to have the most information to help guide. Because part of your treatment team, that's what I like to call all these people, they're your treatment team. They all need to work together. So when a patient comes into my office, if I have somebody come into my office, I have them sign a release so that I can talk to certain people. Because I'm going to need to tell their primary care physician that maybe something has changed and you told me that your diet has changed, and they need to know because that might affect your medication and things like that. So the next and the final person that you need to enlist in your treatment team is a dietitian. Now, I have a lot of friends that are dietitians, and they always joke that they're your worst enemy because you will probably dislike them, and that's normal because they're going to tell you things you don't want to hear and you don't want to do. So, but they're pivotal to your treatment. So finding a dietitian, you have to find someone that you not only feel comfortable with, but that you're willing to let them push you. Now, a therapist, someone like me, we're supposed to be kind of soft and cuddly, but a dietitian is going to be a little bit harder, but they have a soft side too, and you have to hear them out. And what they will do is help you put together a meal plan, snack options, ways to deal with the holidays. What do I do when I'm going over to my grandma's and I know she's going to make this, and that's really difficult for me? They'll give you a plan. They'll tell you what to do so that you stay on track to a healthy mind and healthy body. So you have to enlist a dietitian, even though there's going to be times when you wish I'd never told you this. So I know that's a lot of information. Those are a lot of different people. And you're thinking, I don't even want to talk to one person, let alone all 6. But you need to have a treatment team behind you because we're there. We're like the people in the stands rooting for you to do better. So each person is pivotal to your treatment. And if you don't know who to go to, ask your therapist, ask your dietitian, maybe ask your primary care physician. Whoever you are already seeing, ask them. Because a lot of times we'll know people who've worked with eating disorders before so that you can feel more comfortable. It's not a shock. We've dealt with it before, hundreds of times. So those are just some helpful hints on how to deal with all the people that could be involved in your treatment team. So hopefully you find that helpful. And remember, you can subscribe to my videos so that each time I post a new video, you know about it. And also remember to comment. I love getting your questions. This helps me get new videos out there that can help you with new information that's important to you today. So please feel free to leave as many comments as you like. And remember, we're on this journey together to a healthy mind and a healthy body.